Hi there, my name is Peter Palmiato with Maryland Medicare Options. Thanks for watching my video real quick. If you or somebody you know is going to become or is already Medicare eligible, I'm definitely the type of person, an independent broker, that can help them find the information they're looking for, decipher which plans are available in your area, and definitely help you or the person you love get signed up for the right plan that's right for their situation. So just a little bit about me. I am originally from San Diego, and I was there pretty much all my life. I've been married since 2003. I've got four beautiful daughters, and we now reside in Annapolis, Maryland since 2018. We absolutely love it here, and it's just a whole different lifestyle change from Southern California. I ran a very successful Medicare business out there, and I've started it out here in Maryland as well because there is such a huge demand. There's a lot of misinformation out there. People just don't understand what their options are. And if they do know about a few of their options, they're unaware of how to enroll or which plan might be the best for their situation. So I've been an independent Medicare insurance broker since 2011. I've helped hundreds and hundreds, probably 800 or 900 at this point, as far as seniors that I've helped enroll into a Medicare plan to make sure they're fully covered. And there are no charges for my services because I'm a broker and I work independently. So I'm licensed and authorized to sell and offer Medicare supplement plans, which are also known as gap plans or Medigap plans like Plan F, Plan N, Plan G. I'm also licensed. I take an additional 30 to 60 hours per year, and that's every single year of training to be able to sell and market Advantage plans, which are Medicare Part C plans. And in here in Maryland, we have HMOs, we have PPOs, we have Medicare Savings Account options, we have CSNPs, which are special needs plans for people that are either on Medicaid or institutionalized, like in a long-term care facility. I'm also licensed to sell and market prescription drug plans throughout the state, and Medicare is all I do. So I'm a specialist in this field. I will not be trying to sell you life insurance or dental insurance or any other type of insurance. Now, I'm licensed to do so. So if you ask me about it, I will look into it or I will refer you out. But Medicare is my specialty. That's really all I do. So as a Medicare broker, I can actually explain what your Medicare insurance options are. And since there are so many people out there that they understand a little bit about Medicare, but they just don't know where to go to find out which plans are in the state and what they should be selecting. So I can meet with you virtually through like a Zoom meeting, a face-to-face Zoom meeting online, like a virtual face-to-face meeting. We can talk over the phone. I can do e-apps, which are just all done online through DocuSign. We can do email, fax. We can even mail stuff to each other, or we can meet in person. And I typically come to people's homes. They'll usually have some neighbors and friends over to listen to what I have to say. Or we can meet at a neutral location like a restaurant or local coffee shop. And I do bring everything with me so you can get signed up that day if you want it. Now, I will also help show you different plans from different companies. Since I'm licensed and authorized to sell from 20 different companies here in Maryland, I have and carry around a very comprehensive list of all the plans available in the state. Now, this includes things like, or plans from University of Maryland, Johns Hopkins, Kaiser, Cigna, United Healthcare, big carriers you've heard of, and even some carriers you may not have heard of, some smaller carriers that have some pretty good programs and some pretty good rates. So I do carry everything with me. I am authorized to sell by all the major carriers. So that's kind of the benefit of working with a broker versus maybe like an agent that you're calling. You know, they might live in Topeka, Kansas. Nothing against Topeka, Kansas, but they just don't know the Maryland market, and they may not be authorized to sell all the types of plans that are here specifically for Marylanders. So working with somebody local that's a broker, I think offers you a lot more choices and a lot better decision making. And the last thing is I handle all the paperwork for you, all the submission, the follow-up, and any inquiries. So if you think the insurance carrier is trying to get over on you, you can just call me and say, hey, Peter, what's going on? Can you check into this? Are my rates still good? Do I still have the best rates? I will do that for you. And to be honest, I'm probably a lot easier to get a hold of than most insurance carriers. I don't know if you've ever sat on hold with them, but it is quite frustrating. So I go through the entire process. I will handle all the paperwork submission and make sure, to cross the T's and dot the I's and make sure that everything that you need to be approved quickly without any issues is done properly. And again, I'm licensed and authorized to do all of that on your behalf. Now, the last part is, how do you get started? Getting started is pretty easy, and you can see that you can call me by dialing 410-896-1212, or you can get a hold of me on my email, which is my full name, peterpalmiato@gmail.com. And of course, I have my website, marylandmedicareoptions.com. So that's pretty much it. Again, all my services are free. I am compensated by the insurance carriers when I submit business. But since I am with all the insurance carriers, to me, it just doesn't matter which one you ultimately select, because I'm going to give you some apples to apples comparisons, and then you ultimately get to pick which one you think is going to work best for you. I handle all the paperwork. Now, the insurance carriers pay me a flat rate, and all the insurance carriers pay me the same amount. And that's fixed by law. So I'm not going to be biased or try to push you into one plan over the next because maybe I'm trying to earn a trip to Vegas or earn a new car or something like that. Those just don't exist in the Medicare world. So to me, I'm very unbiased. I'll show you all your options. I'll help whittle it down to 2 or 3 plans. We'll do some apples to apples comparisons. And then you just let me know which plan you think would work best for you. I submit the paperwork, get you approved, and you are fully covered going forward. Now, if you have any questions, please get a hold of me through one of these 3 methods. As you see on my website, I do have the ability for you to book an appointment with me right online. Now, I am in Annapolis. However, I will drive all the way to the very far western part of Maryland to meet with you, like Oakland, and I will drive to the entire eastern part of Maryland, Salisbury and beyond to meet with you. However, if you're in counties that maybe will take me more than an hour's drive, I do request that you just email me first or give me a call so we can discuss setting up an appropriate time that I can get to you, or we can do everything virtually. But if you're here in Anne Arundel or Howard or any other really close, Baltimore or even close to DC, somewhere I can get to with an hour's drive, just go ahead and book an appointment online and I will show up anywhere you want me to. So that's pretty much it. Get a hold of me. If you have any questions, just let me know and I'll be happy to help you. Thanks so much, and hopefully we'll be talking soon.